more than 500 facilities in the state of Washington have reported COVID-19 cases among residents or staff. And as you heard Secretary Weissman say, they accounted for more than 800 deaths being associated with those, which was roughly a little less than 60% of the state's total. And those have occurred in these facilities. Some families have had to endure the unthinkable, saying goodbye to loved ones on virtual platforms like FaceTime or Zoom, instead of being there at the bedside, holding the hands of their loved ones. But still, the toll would have been undoubtedly much greater without restricting those visitations and implementing other emergency measures. As the agency responsible for regulating long-term care facilities, the difficult decision to restrict visitors also bought DSHS time. Our investigators fanned out across the state and visited every one of those 4,000 facilities to conduct infection control surveys. They made sure the facilities were properly screening employees for COVID-19 symptoms before every shift, that facilities were diligently practicing proper hand hygiene and isolating residents who tested positive for COVID-19. That's more than 200 nursing homes, 500 assisted living facilities, and over 3,000 adult family homes. We have also spent the past few months working diligently with families, advocates, stakeholders, and our partners at the Department of Health to craft this phased reopening plan. It's designed to keep Washingtonians that are highly susceptible to this virus safe and healthy during the pandemic, while providing them with much needed quality of time with their loved ones. This plan, as Governor Inslee said, will mirror the Governor's Safe Start plan. But I want to be clear that there are additional criteria that a long-term care facility must meet before advancing to the phase that the particular county they reside in is in. So, in addition to long-term care facilities being in line with their county phase, the facility must be able to have access to consistent testing for residents and staff. In addition to that, it has to have gone 28 days without a positive test in the facility. And the facility must have at least 14-day supply of personal protective equipment on